Hello, I'm Dr. Georgie Agar and I'm a lecturer at Aston University. And this Sleeptember I would love to share with you some of the findings from my Cerebra funded sleep PhD, where I was really interested in learning more about sleep in children with rare genetic syndromes. So in this study I'm going to talk about, we asked children to wear two types of watches overnight. The first of these was an ActiWatch, which some of you might have heard of. These are fancy accelerometers, basically, so they're movement sensors that we use to help us understand whether children are awake or asleep overnight based on how much they're moving. And we also asked children and their caregivers to wear another type of watch which I custom built for the study. So these were proximity watches. What they do is measure the proximity between wearers, so how close children and their caregivers were overnight. And from this we could look at how many times children and their caregivers interacted overnight, for how long for, and what the overall pattern of this proximity looked like. Now this is really important because behavioural sleep interventions, which are often recommended for children with complex needs, are based on this assumption that children and caregivers frequently interact overnight and that these interactions are somehow making the sleep problem more persistent, making it difficult for children to self-soothe or go back to sleep without parental involvement. But until this study, there's been no direct examination of whether this is the case. So what did we actually find? Well, firstly, the ActiWatches showed that sleep was objectively poor for all children in the study, which is what we had expected given our previous research in these groups, using ActiWatches and also speaking to parents about their children's sleep. However, what was new in this study was we saw three different patterns of proximity data overnight. So the first pattern was of caregivers regularly checking on their children overnight. And the ActiWatches showed that this checking happened sometimes when children were awake, so those kinds of interactions where parents are trying to help children go back to sleep, which a lot of us will be familiar with. But also these interactions were happening when the ActiWatches said the child was asleep, which suggests that many caregivers need to attend to their children's medical needs overnight. And this is a big part of caring for a child with additional needs overnight. And it's worth saying these interactions look different in each family, how long they went on for and how frequent they were. Some families were completing these checks more often and some less often. But on average, caregivers were completing these checks hourly. So as I say, this is a substantial involvement for caregivers in their children's well-being overnight. Now the second pattern was a pattern that we referred to as co-sleeping. And this was where children were spending part of the night lying in close proximity to one or more of their caregivers, and this would happen for one night in the study or part of a night in the study. And this pattern of co-sleeping, we know from our other research, is an approach that families sometimes feel that they need to take as a way to keep their children safe overnight. So this was an approach that families were taking on one night out of four on average to keep their children safe. Now the third pattern is really interesting. In this pattern, children and their caregivers didn't interact at all overnight. So once the child had fallen asleep and the bedtime routine was completed, the caregiver left the room and they didn't return, and the child didn't go to the caregiver at all overnight. So all in all, these findings highlight the range of approaches that are taken by caregivers and support previous interview studies which describe the complexities of caring for children with genetic syndromes overnight. The findings also suggest that behavioural sleep interventions may not be appropriate for all children in these groups, because even when there were no overnight interactions according to the proximity watches, the ActiWatches still told us that for children in those groups, sleep was still objectively poor. So this suggests that there are other factors which might underpin night waking and difficulty with sleep in these groups. And these might be biological factors, or they could perhaps stem from undetected or undertreated pain. And it's really worth clinicians ruling these factors out before suggesting behavioural sleep interventions for families. It's also really important for us to consider sleep in genetic syndromes within the whole wider family context. We need to recognise that caregivers use a range of strategies to promote their child's sleep, and it's really important to help families keep their children safe overnight as well. So this was a brief summary of the findings. The full study was recently published in Behavioural Sleep Medicine. It's available open access, which means you can read it and download it without cost, and you don't need a subscription. And you can also share it with your child's school or health professional. So you can scan the QR code or follow the link to read and share the paper. Thank you so much for listening.